Thank you, Lord.
My life is in your hands. Music from Moses Bliss, playing right here on Hope FM. Listen and leave. Great to have you here with us. And Moses Bliss has been our artist of the week here on Breath of Heaven. And he has recorded numerous singles throughout the years, including You I Live For, God Is Real, and many others. He became renowned after the 2019 release of his well-known hit song, Too Faithful. Moses Bliss has been making good music since the year 2017. Some of his songs, In O Day, Fall, My Hand, Moses Bliss, Bigger Every Day, and other spirit-filled songs that gained massive streams on digital platforms. And he continues to be a blessing to us in the body of Christ. It is now 14 minutes past 8. Welcome to the second hour of Breath of Heaven. It's always a joy to have you here with us. It's time to learn, and you have an opportunity to listen in and also watch live on Facebook, on YouTube, and on X. We're live there as we get to have this conversation revolving around this condition known as club foot. And joining me is Dr. Daniel Kariru, who is all set to join us. This is Dr. Daniel Kihiko Kariru, all the way from PCEA Kikuyu Hospital, ready to speak to us. First and foremost, we'll get to find out how he's faring on and what he does there on a daily. Then we'll carry on. Karibu sana daktari.
Asante sana.
Yeah, how have you been?
Been okay.
Mm-hmm.
Quite good.
Yes.
Trying to fix the people's problem, dealing with orthopedic up in PCEA Kikuyu Hospital.
All right. Yes. So on a daily, you say you're an orthopedic. Tell us, let's understand more about what you do there at PCEA Kikuyu Hospital.
Okay. I'm a trained clinical officer specializing in orthopedic and trauma. So I attend to patients in our PCEA Kikuyu Hospital orthopedic unit. We usually deal with screening of the patients, trying to see what their problem is, and advising them accordingly, initiating treatment, and following up on how they are doing. And we deal with all people, from children to the elderly. That's what we basically do at PCEA Kikuyu Hospital.
All right. So, yeah, we are grateful that you have joined us tonight, and we'll be sharing regarding a clinic that happens once a week and for children, basically. And we'll be getting to that in a little while. But we're so grateful as well that we'll be able to learn a thing or two, especially in this session. And so, tonight, let's get to understand the elephant in the room. And we talked about the issue of club foot. What is club foot?
Okay, thank you very much. Club foot is a condition that usually children are born with. It's a condition that affects the foot. You find that this child are born with a foot that it's bending inward. That means if they try to step, they're stepping with the outer border of the foot instead of stepping with the sole of the foot. So the sole of the foot is bending inward. So they're only left to step with the outer border of the foot. And also you find that the forefoot or the fingers, the fingers and the front part as next to the fingers is bending inward. The heel is also bending inward, but a bit tilted upward. So it's usually characterized with the medial crease. The sole of the foot has a lifted part on the inner side. That's what we call the medial arc. So you find where the medial arc is supposed to be, there is a deep fold. We call it a crease. And also posteriorly, just behind the heel, there's another crease there. And you find that this condition is usually caused by tightness of different tendons and that attach on the bones of the foot. So you find the tendon coming from the calf muscle, which usually if you touch behind your heel, just up a bit, few inches, you find a very thick tendon. It's called the Achilles tendon. You find the Achilles tendon is short. So this pulls the heel upward and rotates it inward. Also, and another combination of other muscles on the front part. This results to some of the bone at the mid of the foot being displaced towards the inner side of the foot. Yes.
For a parent who is listening to us tonight, would you like to tell them how many types of club foot do we have, or it's only a given type of club foot that a child can get?
No, club foot is classified in different types. The commonest one is the one we call idiopathic. The cause is not known. The child are just born, and as when the child are born, within the first 24 hours, they're supposed to be done something called a neonatal examination. It's a head-to-toe examination that check different parameters of their body, so as we're able to help them as they grow. So most of them, you find they have a foot that is inward rotated, but it's not associated with anything else. So that covers almost 90% of the condition. We have others which we call secondary. These are club foots, deformities that are associated with other conditions. Mostly we have the neurogenic, where you find there is an interruption of the nerve supply. This can be found with children who are born with a condition called spina bifida, where there is an exposed part of their spinal cord, usually on the lower part, or the components that make the spinal cord, they are exposed at the lower end of their backbone. Also, child who suffer cerebral palsy. This is a condition where a child suffers lack of oxygen in their brain, either during birth or due to another medical condition in infancy, that is before they attain the age of 1 year. And also, if a child is born with a condition where there's a compression of their spinal cord. There are others that we call syndromic, meaning they occur in a syndrome, in other medical issues that are quite grouped together. A number of them, there is a constriction band syndrome, and also there are some children who are born without the bone of the tibia. The tibia is the leg, the big bone that you touch on your leg. That's the tibia. Some children are born without that bone. So they end up with the leg being rotated inward because the muscles are shorter and tighter. Yes.
And so in case you're joining us right now, we are with Dr. Daniel from PCEA Kikuyu Hospital, sharing with us more about club foot. And so for a parent who'd like to know, especially for their child, how is the club foot diagnosed for a child? There's some things that you have mentioned at the very beginning, probably just to let the parent know that this particular child is suffering. These are the things that the parent should look out for.
Okay.
Yeah.
Usually, the diagnosis of club foot is usually clinical.
Okay.
You have to look at the foot and examine. This is now the attending clinician or the gynecologist or the nurse, even in that maternity ward. They're able to see that child involuntarily or without the child control, the foot is facing inward. And if they try to correct it so as it faces outward, it's impossible, and the child feels a lot of pain. For a mother at home, when they are bathing their children, when they are changing them, just observing at the foot how they put it. Usually you will see whether the foot is facing, the sole of the foot is facing straight downward away from the child, or is facing inward, trying to face to the other leg. It's also good to say this club foot can affect one leg, whereas the other one is the one foot, whereas the other one is okay, or it can affect both of them. 80% of the children of the club foot that we find, usually they are unilateral, whereas 20% are bilateral, meaning they're affecting both of them. It's a condition that is quite common. It's one of the commonest orthopedic deformities in children, because in every 1,000 live birth, every 1,000 children born, one of them has club foot. And it's more common in boys than in girls, The reason is not known. So men, boys are quite, if you find one girl with club foot, 2.5 boys, or you can say 3 boys are expected to have club foot. Yes. Yes.
So after looking at the issue of diagnosis and all, could we look at the treatment options that are available for club foot?
Okay. There are treatment options available for club foot. If it's identified at a younger age, a child below 2 years, preferably, the best time to identify it and to correct it is immediately after birth. We have some 2 options. One is non-surgical, where you don't operate, and the other option is surgical. For children below 2 years, and even for children below 5 years, the non-surgical approach is better and it's cheaper. We have a treatment which was developed. It's called Ponseti method. It was developed by Dr. Ignacio Ponseti, who was a Spanish-American physician who had specialized in care for orthopedic. This is for non-operative approach, non-surgical approach. It has 2 phases. It has one, we call it the corrective phase, and second phase, we call it the maintenance phase. For the corrective phase, since the foot is facing inward, we try by manual manipulation and massage to move the foot facing downward. We do manual manipulation and we cast. Casting by its application of plaster. So you massage the foot, move it a bit, then cast it, hold it in a plaster in that position. This way, because the muscles of this child are not strong and they are still developing, you're able to influence them to lengthen and move with the foot as you go. The casting is usually done once a week. It's weekly, and the plaster is applied from the tips of the toe all the way up to the groin area with the knee bent. So this allows the foot to move backward, the sole to go facing down, and the front foot to start facing outward. Remember we said the sole was facing inward and the toes were facing inward too. So you're trying to correct it, the sole to face downward and the toes to face outward. So this is done weekly. If a child is started at an early age, they will require around 4 to 8 sessions, once a week, and as we progress. So once we find that the correction, by the time we do the 4th to the 6th one, we find that the foot is now facing downward. The sole of the foot is facing now downward. But now we have a challenge because we said the tendon behind the heel is short. So the foot will be facing downward, but in a tiptoe position. So this way we will have corrected the medial crease that I said would be deep, and also we have tried the correction of the posterior crease, the fold of the skin just behind the heel will have improved a bit. So at that juncture, we usually do a small incision at the back of that Achilles tendon, and we cut it. Once we cut it, we are able to release the foot now to stretch it out. So a mother will ask, if you cut it now, what will happen? It's a very simple clinical procedure. It's done by somebody who is trained in that area. It involves just numbing the area with the local anesthetic, introducing a very small incision with no bleeding at all, and rupturing the tendon. This is a child, an infant who is continuously growing. The tendon usually heals on its own, and now you're able to correct the tiptoe and bring the foot now straight to the ground. So after doing that, we put them on a cast in that position for a period of 3 weeks to allow the tendon to grow and reattach and also heal. And after that, now we go to the next phase of treatment. The next phase of treatment is the maintenance. Once you correct this foot, because these muscles were weak, it has a tendency of recurring. So out of research, we've realized if you leave it that way, it will come back. So we now start putting these children in a special kind of a shoe that is attached. There are two pairs of shoes attached by a bar of metal from one heel to the other, and the foot is positioned facing outward. We call that abduction, facing outward at around 45 degrees. So for the first 12 weeks, that is 3 months, after doing the simple procedure we call tenotomy, this kid is usually put in those shoes, because at this age, this kid is barely 2 to 3 months. So they are not sitting, they are not walking. So you put them in that shoe for 23 hours a day. They are allowed 1 hour or holiday or relief. That 1 hour you bathe the child and do all that. And they are holding that position for 12 weeks. Then from there, we shift to them wearing that shoe when they are sleeping, because they are still growing. By that time, you expect they are around 5-6 months. They are now sitting up. They are now trying to reach out for things and all that. So we only now put the brace. We call them braces. We are now the abductor braces. We are now put the braces only at night, all when they are sleeping. If they sleep during the day, you can put. If they sleep during the night, they sleep with them. And they continuously do this until the age of 4 years. By doing so, we are sure the muscles have lengthened and they have healed in a stretched position that will not recur back again. Yes.
Wow, great info there regarding club foot. In case you are joining us right now, we are discussing club foot here on Breath of Heaven Thursday edition, and with me I have Dr. Daniel. In a little while, we'll continue with this conversation. We invite you to send your questions or your comments to 20933 or on WhatsApp 0717 400 555. And this is just to remind you that this coming Friday, that is tomorrow, yes, we'll be having a wonderful time of prayer. Just praying for you, praying for me, and, having that fellowship from 10 p.m. all the way to 5 in the morning on Saturday. We'll be praying together, because every milestone always sets rolling a new beginning. And in the mood of celebrating 20 years of on-air ministry through Hope FM, we'd like to invite you to pray with us as we set the agenda for the next 20 and beyond. Join us for the Hope FM on-air Kesha, dubbed Beyond 20, that will happen tomorrow from 10 p.m. to 5 a.m. Tune in for an amazing time in the presence of God as we seek His face, setting the agenda for a lifestyle of worship and prayer. Matthew chapter 21 and verse 13, it is written, He said to them, My house will be called a house of prayer. All are welcome.
Hope FM exists to know God and make Him known through evangelism and discipleship. For feedback, suggestions, or complaints regarding our programming, talk to us on 0709 861180 or email us on feedback@hopefm.org.
Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media?
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcast?
Really? Even Miss of the What?
Yeah. I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website, www.hopemediakenya.org. Listen and live.
You, the listener, are the reason why we go on air. You, the friend of hope, are the reason why hope is alive. You have helped us take hope across the country and to the rest of the world. Through your giving, we have been on air for 18 years and witnessed many people coming to the Lord. Through your giving, we have expanded our reach to 3 new regions, namely Kisii, Nyeri, and Meru. Through your giving, we have expanded our reach to an international audience through DSTV and GoTV platforms. Thank you for your sacrifice and generosity toward this great initiative. As we continue spreading hope to the other unreached regions in Kenya, you are invited to be part of the Friends of Hope through a contribution of any amount via M-Pesa Paybill 933933, account name FOH. Friends of Hope, keeping hope alive. God bless you.
Emma Omonge. The song is titled Mungu wa Ishara. He is a God of all wonders, and we can believe in him even today to perform those wonders in our very midst. It is 24 minutes to 9 o'clock. You are listening to Breath of Heaven, this Thursday edition of the program. We're having a conversation revolving around club foot. And with me I have Dr. Daniel from PCEA Kikuyu Hospital sharing with us more insights on what you need to know about club foot and, of course, what they do there for children. And so I'd like to bring in Dr. once again as we continue. And just look at this question. What are the potential complications of club foot if it is not treated?
Okay, thank you very much. That's a good question.
Yes.
If this child is left untreated, they'll end up walking with the outer border of their foot. That is, the line from their small toe heading down to the heel. So they walk more or less with their upper side of the foot, which is not supposed to walk. So usually what happens, they can't be able to wear normal shoes because the sole is inward rotated. They end up forming a very hard callus on that side of the foot because it's not designed originally for walking. That callus is very painful. It occasionally finds it's cracking, it's bleeding, and also gets infected. They are limited to the level of activities that they can participate in. They can't run, they can't play football with the other children, and they are subjected to a lifelong pain on their foot because this foot ends up being shorter, and this shortness will result to a loading problem to the knee and also to the lower back. because they are walking. If it's affecting one side, they are walking with a tilt on one side. They are walking limping to one side. If it's affecting both sides, you find their knees tend to budge outward. So they appear as if they're having a bow leg. So they'll have a complication on the knee, they'll have a complication on the back, and they'll have a lot of problems on their feet. So they'll be limited to the levels of activities and quite a lot of other, limiting them to economic status and all that. And also, these kids growing up, they can't participate in activities that other kids are participating in. So they will want to be able to socialize as well as other kids do, because we know kids usually socialize by their games, playing around, running around. Yes. Yes.
Thank you for that. And so let's get to talk about where you practice at PCEA Kikuyu Hospital. And I'm being reliably informed that the hospital runs a specialized clubfoot clinic every Thursday morning. And probably let us know more about that and why is this clinic so important?
Yes, that's true. At PCEA Kikuyu Hospital, Orthopedic unit, we have a clubfoot clinic every Thursday morning. We've partnered with the Clubfoot Care Kenya and also Hope Walk. They facilitate the clinic. Here in the clinic, we receive referrals of children who have been sent from being identified with Clubfoot and have been sent for us for care. We screen them and diagnose them and start them on treatment, which I said we usually do non-surgical approach first. So we usually see them there. They not only receive treatment there, they also receive counseling, because this is a mother who is young, has a young kid, and now this kid has a deformity. It's a problem. Doesn't look like any other kids. Maybe it's the first child in the family that is having this problem, or it's a second child or that child who is having the same. Because genetics plays quite a big role or contribution to clubfoot. You find if you are born in a family where somebody was born with clubfoot, subsequently you or your child are at a high risk of having clubfoot. So they are advised, they are counseled, and also they form a kind of a support program amongst themselves. Because a new mother will come in and will find a bigger child, 2 years, coming for breast exchange and all that. This child is walking. They'll feel motivated that their child too will walk. So they're able to walk with each other. They're able to motivate each other. We have a clinic parent advisor or counselor who sits down with them, talks with them, and also we interact with them and we support them. Yes, the clinic is free. So from screening to treatment, all that, to bracing, from the age of 0 or 1, from the age of 1 all the way to the age of 5 years, we are able to help them free of charge. Yes.
Thank you so much, Daktari, and bringing hope to the parents and even for the children who are in that condition or having that condition. So carrying on, would you tell us some of the benefits then of having a specialized clubfoot clinic? What are some of the benefits of having such, especially for your case?
For our case, we found if we consolidate these mothers and these children together, we are able to allocate them special time to attend to their needs specifically, without having to integrate them with the other general population coming for other orthopedic condition. Again, these are neonates. These are children below, most of them, they come in when they are below 28 days. And even those small children below 1 year, they are very susceptible to other infections. So we like having them excluded to one side, so as we're able to exclude them from cross infection. And also we're able to attend to the mothers and the children more specifically. This way they're able to feel the love and the touch, and they're also able to relate with each other and see the progress of the condition, and also be able to educate them when they are together. we are very grateful to participate and to have this clinic at PCEA Kikuyu Hospital, Orthopedic Unit, because we're giving hope to children to be able to walk freely. We're able to give them hope to participate in anything they want to be later on in their life as they grow without being limited by a deformity. And bringing back hope to those parents. My child was born with a deformity, they're now progressing them. They're able to watch their child take the first step, just like any other kid will do with their first step. They're able to experience their first run. They're able to see their kid participate in no sports in schools with no limitation, even if they were born with a deformity. That is our joy, and that's why we have that clinic at PCEA Kikuyu Hospital. Yes.
In the course of running the clinic, are there challenges that you have experienced, and probably what can be done to mitigate the challenges?
Okay, yes. We've encountered quite some challenges. Some of them are related to the condition, and some of them are psychosocial challenges that affect now their adherence to the treatment and all that. As I said earlier, is a weekly, or you start with a weekly visit. So this mother has to come every week for the child, for the cast to be changed and everything. Once you cast, if you are casting one, if you are putting plaster on one leg or on two, on both feet, as all we know, plaster is heavy. It's like a stone. So managing this kid also becomes a challenge to the mothers. But we talk to them and help them. The other challenge is related to the condition itself. If this condition is associated, as we said earlier, if it's a secondary condition, you find the treatment, the outcomes are usually not very good, and the treatment period is longer, and some of them end up also having to do some aspect of surgical intervention. If this kid is brought in late as they're able to stand and start walking, now these muscles and these tendons are becoming a bit tighter and more stronger. So you end up with a challenge of the treatment will take longer. This is a bigger kid, so he is able to move around and all that. So compliance becomes a problem. And that one, we try as much as we can do to assist them through the process. But some of these late coming and also associated syndromic, they will end up having to be done one aspect of surgery or the other. On the socioeconomic factors, you find that affects mostly compliance. You get a mother, you start them on clinic, but if they're not able to get fare to come to the clinic, you find them missing clinic. Some of them, cultural issues, they are told, no, this is an outcast, it's not supposed to be here. You find them, instead of, yes, they have been identified at the maternity level, they've been referred, but instead of them bringing the child, they hide the child. So the child will only be seen when they start walking later on in life. Some communities think any form of deformity that a child is born with is associated with bad omen. Others, it's lack of knowledge, lack of awareness, because maybe they'll say their father has clubfoot, so this is a familiar thing, and maybe when their father was born, this clinic weren't running back then, there were no hope for them. But now there is hope for their children. They don't have to suffer the problem their fathers have suffered for the period of time. The lack of awareness, lack of economic status, poor education, and those cultural beliefs are some of the things that give us a challenge. So we try as much as to educate them, to encourage them. We have the clinic advisor or counselor is also a community health worker. So wherever they go out there, they are doing the health promotion. They are able to identify them and bring them. And actually, our biggest referrals are the mothers with kids that we have treated, or the one we are treating. They're able to see the other kids when they go for clinic, and they tell them, come with me to Kikuyu Hospital. My child was born with this condition. You see, now you can't really identify it, so they can also help you. So those are some of the challenges that we face.
All right, thank you for bringing that. And so let's look at probably some of the questions that the parents are already asking. And this one is from Lydia. Lydia saying, thank you for the topic. I am a community health worker in a slum. There is this particular boy who keeps hurting himself because of club foot. He's about 8 years old. Any help? And does Kikuyu Hospital, PCEA Kikuyu Hospital, have a package for the vulnerable population?
Okay, thank you, Lydia, for a good question. Well, now, this is an 8-year-old boy. And as I said, one of the complications is what Lydia is talking about. The kid is walking on the outer surface, it's getting colors, and it's getting hard. So it keeps bleeding, breaking and bleeding occasionally. Yes, at PCEA Kikuyu Hospital, the child can be helped. But now this kid will need a surgical intervention. What I would encourage Lydia to do, advise the parent to bring the child for screening and evaluation. Then from there, we'll advise them going forward what we can do to help them. Yes, but there is still hope for that child. Yes.
Another one here saying, hello, Daktari, do you attend to children who have been brought directly to your clinic without referral?
Yes, just as I said previously, our biggest referrals are mothers who we are treating and they see other children. Anybody is welcome. Even some of the parents who come, they think their children is having crab foot, but on examination, it's not crab foot. It's a tendency of the child to put to put the foot in one position. So they are welcome to come. Yes, you don't really need an actual referral. You can walk in. We'll screen you any day, Monday to Friday. The orthopedic unit runs Monday to Friday from 8 to around 4 in the evening. We can screen them. Then we enroll them to the Thursday clinic. So they're welcome to come. Yes.
I know at some point you had mentioned a few of the common misconceptions that come with club foot. Probably you could mention others apart from the fact that these children are being referred to as outcasts. Any other thing you'd like to add on that?
Okay, some other misconception people have come across or when I'm practicing is the fact that some say their mother was trying to hide the pregnancy. And they were tying, either they were wearing tight trousers, tight skirts, or they were tying something around the pregnancy, the abdomen, so causing the constriction. This is not true. And because we have been able to identify most of the risk factors associated with crab foot. One is genetics. Whether a parent or a sibling who has crab foot, you have high chances the subsequent sibling, all your children will have crab foot. One of the environmental factors associated with club foot is a maternal smoking during pregnancy. Yes. Besides all other conditions, the heart condition, the lung condition, the brain underdevelopment that can result from maternal smoking, that one can also contribute. And also one of the other risk factor is being male, which is because chances of being male and having are thrice higher in male than in female. Yes.
All right. And so I've talked about there's common misconceptions and all. And would you tell us, apart from there's what you mentioned, Ponseti method, are there any recent advances in club foot treatment that you would be knowing of?
Yes. Ponseti was started sometimes in 1980s. It has been been absorbed, and it's what we are practicing here. And it has been it's economical. It's very cheap because we're using plaster, which is relatively cheap, and just keep changing it and altering. There is no surgical. The surgical intervention we use a small blade, which is also very cheap. So there's no hospitalization period. There are other treatment models which are being researched now. There is one in France where they visit a physical therapist, and there's foot manipulation with abduction shoes and strapping with some kind of tapes. that now angulate the foot inward and try to hold them in that position. There is also another one which was undergoing in this country in some few centers, where there is a shoe, a certain form of shoe that a kid is put on, but has a spiral kind of material that is winding on the limb all the way from the foot coming up to the growing area. So it's kind of replacing the plaster, but it's still undergoing. It's under research, and if the outcomes compared to plaster are better, then we'll still be able to utilize it. But currently we are using the Ponseti, but there are quite a number of others that are happening. Also, there are some people who advocate for surgical treatment, but it has its own challenges and shortcomings here and there. Yes.
For a parent listening to us, a parent or a guardian, what would your advice be, especially for their children who have been diagnosed with clubfoot? Probably there's that advice that you'd like to give them.
For the parents and the guardians, I would like to tell them adherence is key. Being able to follow the treatment, and this the treatment has proven to be very successful, 90% successful. So there is hope that their kids will walk normally like anybody else and participate in everything that they want to do. I would like to encourage them to keep following up with the clinics and to keep applying what they've been told. If I've been put on brace, to try and apply. Some of these kids, as they grow, they are now becoming more manipulative. So the brace has shoes. They are tied they are fixed in a bar rod. So the shoes has races. So these kids, as they grow, they like playing with everything in their environment. So they end up putting the races, they remove the shoes. So the mother has sometimes to wake up at night, or the parent has to wake up at night and go check, are they still in possession, or have they removed, and all that. My advice, don't tire, because this treatment work and your child is going to be okay. Yes.
Any other concluding thought that you would like to leave us with? Probably something that you wanted us to know regarding your clinic, that even probably a way that this listener can get in touch with you. I've seen a number of them who would really be interested to work with you in that regard. An orthopedic and trauma officer too, with 2 years experience in the Ponseti and other orthopedic conditions treatment, and saying recently volunteered with APDK portrays, and would like to have that opportunity to practice at PCEA Kikuyu Hospital. Such and any other person would like to get in touch with your hospital.
Okay, I would like to say they are most welcome, because at PCEA Kikuyu Hospital, orthopedic unit, and the whole general hospital, we usually welcome everybody who walks through our door seeking our help. So I'd like to welcome them. And our clinic is usually on Thursday, as you had probably said. And anybody besides clubfoot, anybody with any other child who has any other orthopedic problem, and even bigger people, adults and an elderly patient, they can pay us a visit. We'll be able to help them out. And the clinic lands on Thursday, and it's free of charge. Maybe I can give them contact to the clinic parent advisor. She's Eunice Wawera. You can give her a call. She'll be much welcome to receive your calls. Her phone number is 0724 130 582. Yeah, she's Eunice Wawera. She's a counselor. She'll be able to help you. For those who are late, they are past 2 years, they are past 5 years, where Ponseti methods will not be of great help to them, we have the option of surgical intervention, which we have qualified surgeons. They are available Monday to Friday. They'll be able to review with them, and they'll be able to structure a surgery that will help correct. So it's not late. Even for the adults who their foot were born with clubfoot, there was no knowledge, there was no awareness back in the days, and they are now suffering. They come. We can be able to help them, and they regain their mobility, they improve their mobility, reduce the pain, and the quality of life also improves. Yes.
Thank you so much, Dr. It was a joy hosting you here at Hope FM. We're looking forward to having more conversations and, working together in this regard. And you can pass our regards as well to the team there at Kikuyu Hospital, PCEA Kikuyu Hospital. We have really, really appreciated your services there.
Okay, thank you very much, Jackton. I'm very grateful
Yes.
for creating this awareness here at Hope FM.
Yes.
And June 3rd is usually our Club Food Day. It was chosen and inaugurated around 12 years ago. Apparently, it's the birthday of Dr. Ignacio Ponsetti, it's the one who started the Ponsetti method and was very passionate about the treatment. Apparently, he passed away. She passed away around 2009. Yes. So we are very grateful for this creation of awareness. The awareness continues online, and quite a number. We have a list from Hope Walk Kenya. Quite a number of clinics that participate in this program. We are not the only one who does crab food treatment. So maybe a parent is in Bika, is in Kajiado, is in Makueni, and they feel coming to Kikuyu is quite a distance for them. Maybe economically it's a challenge to them. I would advise them walking into that county hospital in your facility, in your near area. Consult with them, and they will direct you where you find Club Food Care Kenya or Hope Walk Clinic, where it's situated, and you get the services. For those who can be able to reach us, they can come to Kikuyu. They're much welcome. Yes.
All right. That's just about it with my conversation here. Dr. Daniel Kihiko Kariru from PCEA Kikuyu Hospital, an orthopedic and trauma clinical officer working there. It's always a joy to have such people with us here who can help us in such instances. Well, coming up in the next hour, we have from the scriptures as well as a time of praying together and looking into the Word of God right here on Breath of Heaven.
Breath of Heaven.
And that today we don't say thank you to God. There are some things